What is up, you guys? Welcome back to our class. This is your Pharmacy Informatics week number 6, part 2. So this video is the continuation of the application of computer in Pharmacy Informatics. In the previous video, we had our discussion about the 5 common application of computer in Pharmacy Informatics. Now, we'll be dealing with the 5 advanced application of computer in Pharmacy Informatics. Without delay, let's proceed to the first advanced application. Our first advanced application is known as your CADD. Your CADD, it means Computer Aided Drug Design. CADD is referred as a distinct and advanced drug designing process. Why advanced? Because it speeds up the early stage development of new active compounds. CADD is a process of pronouncement or declaration of new medications, and this is usually supported with documentations. So what's the contribution of CADD? Using defined computer software which records data and databases, the medicinal chemists have a scope to design the new molecules and improve their efficiency. Right away, let's proceed to our second advanced application. Our second advanced application is called your diagnostic laboratories. Remember before that manual recording is practiced? Instead of manually recording data, which is time-consuming, computers act as a preprocessor which will already convert the raw data to digital format and finally gives the numerical values in the reports. And this is mainly applied in CT scan and MRI scans. Now let's have the third advanced application. Our third advanced application is the use of computers in pharmaceutical formulations. Applications of computer in pharmaceutical formulations give consideration in correctly choosing the right additives and excipients for the provision of safety, efficacy, and stability. With the suggestion of FDA, the use of DOE should be adhered. Your DOE stands for Design of Experiment. The DOE enables user to choose a experimental design. For example, mixture experiments are useful in many pharmaceutical applications. A typical mixture experiment might be used to investigate the effect of changing the proportions of polymer, drug, and 3 excipients on 4 responses in a sustained release tablet based on a hydrophilic polymer. DOE software makes it easy to define the design space by entering low and high values for each component. So this is usually an experimentation on finding out which design is the best. Without delay, let's check out our fourth advanced application. Our fourth advanced application is the use of computers in toxicology and risk assessment. Usually, when we're talking about toxicology, there is this what we call the toxicity prediction, which requires the following. More toxicity data of greater consistency are required. A better mechanistic appreciation of clear toxicity is needed. And the model user should consider use of a variety of techniques instead of relying on a single prediction. Now let us have examples of softwares used in toxicology and risk assessment. First, we have your direct Nexus. Your direct Nexus predicts toxicological profiles by evaluating evidence for and against a broad collection of endpoints. Another one is your Hazard Expert. It identifies toxic molecules based on fragments, also calculates bioavailability, accumulation, and other parameters. Another example is called your Virtual Tox Lab. It is a software for predicting hormonal receptors, drug metabolizing enzymes, and their modulators. Next, we have your TopCat. Your TopCat is a software that predicts toxicity measures in a variety of in vitro assays and animal models. Our fifth example is called your Percepta Toxicity Modules. This software helps in the prediction of acute toxicity, aquatic toxicity, endocrine disruption, and genotoxicity. Our last example is called your ADMET Predictor. This software helps in the prediction of endocrine disruption, skin sensitization, phospholipids, and so on. Lastly, we'll have our last advanced application. Our last advanced application is called your clinical trial management. Preclinical studies and clinical trials are the most important part of current drug development, which evaluates pharmacological benefits along with the toxicological risk associated with the use of the medicine. Computer softwares helps to ensure the safety therapeutic window for most of the drugs. So we have here examples of clinical trial management softwares. First, we have the Oracle Clinical V4I from Oracle Corporation. Another one would be your Data Labs XC from Data Labs Incorporation. Third, we have your Trial Master from Omnicom Systems. And we have CliniPlus Data Management from DZC Software Solution Incorporation. Our second to the last example is called your Open Clinica software, which was constructed by Akaza Research from Cambridge. And lastly, we have your Electronic Data Capture from DSG Incorporation. And that's it. Those are the 5 examples of advanced application of computer in pharmacy informatics. And this will be the last part of our discussion for our pharmacy informatics. I hope you enjoyed my class and my presentation and my voice. Charot lang, masyadong formal. So maraming salamat sa inyo guys, sa aking mga students sa pag-comply sa ating mga requirements and sa mga comments nyo na ginagawa. I hope na talagang natuto kayong mabuti sa mga lessons na mga prepare ko and mga activities na prepare ko. So again, this is our last video for our pharmacy informatics, and I'll see you on our first sem para makita natin kung ano ulit yung mga videos na gagawin natin sa ating mga discussion. So you guys just stay at home. Wow, English. So stay at home lang kayo and keep safe everyone. And don't forget again to comment down below kung ano yung pinaka nagustuhan yung advanced application ng computer sa pharmacy informatics. And that's it guys. Bye-bye.